Hi, my name is Abby.
Mark Graber.
Kira Budick.
David Halperin.
Tracy Plunkett.
Marissa Abram.
Hi, I'm Dave Fielding. I'm a board-certified patient advocate with Engage Caring Solutions. Pulse has really been at the forefront of educating the public and educating patient advocates on how to improve patient safety.
Patient engagement has become a very well recognized movement, but that was certainly not the case when Pulse was founded.
At Pulse, we envision a world where every patient's voice is heard and no one is harmed by healthcare. As a provider, a nurse, and a psychiatric nurse practitioner, this is very important to me. Through our programs such as the advocacy training, we educate the public about patient safety and empower patients and their families to become confident, knowledgeable, active participants in their care.
For 10 years, I've served as Pulse's communications director. When I began working with Pulse, I took its family-centered patient advocacy training, and I began to understand that there are many common-sense ways that we can all help medical professionals deliver safer outcomes from our treatment and care.
One of the programs that I helped to develop was the patient activation through community conversations.
Through their PAC program, I learned a lot about handling situations at doctor's offices as well as at the patient's bedside. This program led me to take the training in family-centered patient advocacy. I've also had wonderful training to be an ambassador for the Take Charge campaign, which is 5 steps to safer healthcare.
One of the things that I learned from Pulse, when you are at your doctor's office, there's 3 questions that you want answers to.
I came into contact with Pulse in October of 2019 when I began interning on the Take Charge campaign. I've learned so much from this experience. As a community health major, I've learned from this campaign just how important it is to be a well-prepared patient.
I'm currently a student hoping to pursue a higher level education within the healthcare field. I've worked with Pulse on the Take Charge campaign, and I feel that Pulse has inspired me to develop both professionally and personally.
My name is Mary Redler. I have taken the family-centered patient advocacy training. You don't really think about a lot of things until they're right in front of you. The Take Charge campaign makes you realize these are things that need to be taken care of in advance.
My journey in partnership with Pulse started with attending a People for Patient Safety dinner meeting. I then took the family advocacy training program, which then led me to a career in patient advocacy.
My name is Tracy Plunkett, and I am the owner of Care Navigation and Advocacy. The Pulse program has helped me understand patient advocacy and that no one case is the same. I really enjoy the sessions where the patient advocates discuss different items and teach each other. I've gotten so much out of the People for Patient Safety meetings. You just learn so much from everybody's experiences, just people who've walked the journey, who are going through things that you go through.
I've been associated with Pulse for almost 15 years now. As a physician, it was an eye-opening experience. I had no idea of the harm from preventable medical error.
It never dawned on me, having been a healthcare executive for 35 years, that there was a whole other side to look at patient safety.
Pulse has a wonderful advocacy program where they teach us how to be good advocates, not only for ourselves, but for our family.
My daughter was diagnosed with cancer, and I just wanted help. You're not sure what to do. I had confidence that Pulse was the place to call to get me on the right track.
Pulse taught me how to take care of my mother while she was in the hospital, what questions to ask, and how to prepare for her surgery and her aftercare.
I did have a medical injury, and I basically had nowhere to turn. Eileen offered her support, and she was just in the process of creating Pulse. It was a great comfort to me. It taught me a lot about advocating for yourself and not being afraid to ask questions.
I came to know Pulse about 20 years ago after I was critically injured in a fertility procedure. I was so glad that I found Pulse because it doesn't go the way you expect or plan, and you're left trying to figure out the proper path. Thankfully, we found Pulse, and that became an integral part of my recovery.
We need to be empowered, and the word empowerment means knowing what to do, when to do it, but also, and this is where Pulse is very important, they give people the skills on how to do it.
There's such a great need for people to understand what good quality care is and at what point you question treatment, what kinds of questions should you ask, just good practical information that would not have occurred to me to bring somebody to a doctor's appointment.
It's an organization that helps the consumer learn how to be a patient. We don't know how to be a patient, and unfortunately, because of that, we have poor outcomes.
Pulse fills a unique role, working at the grassroots community level to educate the public about patient safety. As Pulse says, patient safety policies are set in boardrooms, but medical errors happen at patients' bedsides.
Hi, my name's Mark Graber. I'm an internist and I'm the founder of the Society to Improve Diagnosis in Medicine. I can't believe Pulse is 25. That's amazing. It's hard to think about Pulse without thinking of Eileen.
I have called Eileen and she gave me invaluable feedback on a case I was working on. I truly value her input and experience.
I needed surgery and Eileen became my patient advocate. She was my second pair of ears and a big help in understanding what the treatment would be and what the follow-up care would be.
I met Eileen at the second National Patient Safety Foundation meeting, and one day she proposed that there should be some national recognition of some sort for patient safety, like a day or a stamp. Well, a stamp never happened, but we did propose the idea for a Patient Safety Awareness Week to the National Patient Safety Foundation and the VA, and thankfully they liked it. They adopted the idea. Now, Patient Safety Awareness Week is recognized at virtually every hospital in the United States and many internationally. It's the second week of March, commemorating her son who died tragically of a medical error. Eileen's drive to transfer the tragic story of her son's death into something positive is amazing, and it's been an inspiration to me personally and to really thousands of others across the country. So through Pulse and through Patient Safety Awareness Week, Eileen has had a very important and very positive impact on patient safety and the climate of healthcare safety in this country. So congratulations to Eileen, congratulations to Pulse, and keep up the great work.
I would love to see the organization continue to grow and flourish and have a greater impact on the world and the community at large.
Everything that I've learned from this campaign and from Pulse, I will be advocating and educating to all of my future patients and future clientele.
I view Pulse's work as important and life-affirming, and I'm glad to be part of it.
You know, as I said, it has helped me so much in my personal journey. It has been unbelievable.
I'm really grateful to Pulse Center for Patient Safety Education and Advocacy.
It's funny, there's certain business cards you carry in your pocket. Pulse should be one of them. When you're in a hospital room and someone's care is important, they're going to help you. But they'll also give you the resources and actually get on the phone, make phone calls. I really can't praise them enough.
Eileen, congratulations and thank you for all you've done. I hope this continues for decades to come.
I want to take this moment to congratulate Eileen, Karina, and Pulse for 25 great years. Here's to 25 more.
Pulse has been there every time I picked up the phone, and I am so eternally grateful for that. I just don't know where else I could go to get that type of support, advice, and encouragement.
At Pulse, we listen, we learn, we lead.